Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. What is the reason why these patients are getting landing into varicose veins? First one is genetic. This is the most important cause here. Most of the people, in most of the cases, it is genetic. And also, when you have genetic predisposition, and also you should have factors, that is contributing factors, like when you stand for a prolonged time, long periods of time, so these veins get dilated. Like people like watchmen or teachers or women who cook for a long time at home by standing, these are all the risk factors. And also obesity. When you are obese, there will be more force on your legs compared to when you are thin. So anything that is more obese, or anything that is causing you to improve increase the weight on the legs, that will be landing into varicose veins. And also pregnancy, intra-abdominal pressure is increased, and there will be pressure on arteries and veins of the abdomen, so that the veins have to work hard to push this blood against the gravity. Not only pregnancy, any abdominal uh, tumor, maybe it is benign tumor or malignant tumor, anything that increases the intra-abdominal pressure will land into varicose veins. And also old age, your veins get de-elastified. The elasticity of the veins is lost, and it is also one of the reasons for dilating the vein. And also we see this in athletes. What happens in them is they will be working hard on their calf muscles. When they stop working out, when they stop going for the gym or their athletic activities, these veins get dilated. This is one of the common etiological factor we see in athletes. And coming to pathology, so what happens in pathology, or what happens in varicose veins is, we discussed, right? There will be perforating veins, and also there will be superficial veins. These veins will have the valves which is directing the blood to only one direction. When there is damage in these valves, it may be due to acquired or due to genetics, the blood gets stagnated in the peripheral veins. When the blood gets stagnated in the peripheral veins, they enlarge. These veins enlarge and become tortuous means they become like spring. And the blood is going to be accumulated in these veins. Once the blood is going to be accumulated, what happens is these blood starts to ooze out. The contents of the veins start to ooze out, and this causes eczema. This causes itching there, and also the pigmentation. So once the pigmentation is changed or eczema is there, there will be chance of ulceration. Ulceration means open wounds are formed. These wounds become non-healing and they get infected. Once they get infected, there is every chance that there is cellulitis. Cellulitis is inflammation of legs, and also there are other complications which we are going to look into it. So this is the pathophysiology. There are two types of varicose veins: primary varicose veins and secondary varicose veins. Primary varicose veins are due to damage of the valves. There are three types of valves normally damaging. One is the valves located in the perforating veins, the veins that is carrying the blood from superficial veins to deep veins. If there is any damage in the valves, so we will get varicose veins. And also, when the great saphenous vein enters the femoral vein, we have a valve that we call as saphenofemoral valve. When that valve is damaged, we will get varicose veins, mostly of the thighs. There is one more valve, that is saphenopopliteal valve. That valve is located between where the short saphenous vein enters the popliteal vein. So at that place also we have a valve. When it get damaged, so these veins engorges, they become tortuous, and they show the signs of varicose veins. So these are the primary causes. And what about the secondary causes? Secondary causes are due to pregnancy or any cyst in the abdomen, tumors, whether it may be benign tumors or malignant tumors in abdomen. And also one of the reasons is DVT, deep vein thrombosis. In the deep veins, if there is any thrombosis and there is obstruction, this will leads to stagnating of blood and in the peripheral veins. And also hormone, especially the hormone progesterone in females is responsible for these varicose veins. And also there is a atriovenous fistula. When there is a connection, normally there will not be any connection between arteries and veins. When there is a connection, abnormal connection, whether it may be due to congenital or it may be acquired, So those people also will be landing into varicose veins. And also iliac vein thrombosis, when there is thrombosis in iliac vein, this also leads to increase in the pressure, and also this will allow the backflow of blood into superficial veins. So these are all the secondary causes for varicosities.